Hello? Okay, great. Hi, everybody. I'm told by people in control, we're moving on to our keynote session right now. So I am delighted to introduce my dear colleague, Xuanhe Zhao, whose work is incredibly creative, and I hope you'll enjoy his presentation for this interesting drive to solve important clinical problems using innovative material design, robotics, imaging. Xuanhe's work exemplifies clinical concept to practice that is a theme for this meeting. He has received lots of awards for his research, and I can spend the next 10 minutes stealing the time to list them, but instead I will let him tell you about his research and give him the time to do this. I just want to mention that he has been committed to translating his research into clinical practice by starting the companies, and I learned right before the session that actually all of his companies are led by Korean PhD students who spun off the technology from his lab. So there is also a connection to the locality of the conference today. And so with that, I'll give you Xuanhe Zhao.
Thank you so much, Paulina, for the kind introduction. And I want to thank the organizers for inviting me to join this conference. I was impressed by the talks. I hope to interact more with the attendees and the colleagues and the students. My name is Xuanhe Zhao from MIT. Today I'll talk about bioadhesive ultrasound and the telerobotic neurointervention. Xuanhe Zhao, this is my website. And this is LinkedIn, Twitter. In this age, feel free to get connected. Conflict of interest declaration. I co-founded a few companies. I'm advisor, get a financial interest of others. So I will discuss results related to these companies. Now, the mission of my lab, merging humans and machines. The opportunity we see over the last century, there are great advances in terms of understanding and engineering human body. Biology, medicine, genetics, these are the examples. Similar in the domain of machines, semiconductor industry, electronics, computers, internet, now AI and robotics, right? We see great advance in this domain as well. However, there's a huge gap in between human body and machines. What if we can truly merge them together to let them work together seamlessly? So this, I believe, is one of the greatest science and technological challenges and opportunities in these centuries. We can obtain data and inspirations from human body to guide the design of new machines, for example, AI and robotics. Similarly, we can leverage machines to enhance, even transform human body. The impact is health, AI, robotics, the future form factors of a human, and the list goes very long. Right? So huge impact, great opportunity, but it's also a grand challenge. Right? If you take a look at the fundamental properties of different components of human body, the majority of our tissues, organs are based on soft, white, living materials. On the other hand, traditional machines are mostly based on hard, dry, abiotic materials. Right? How to merge them together? That's a grand challenge. In my lab, we design new soft materials. So these are elastomers, hydrogels, polymers with very similar properties as different components of the human body. Use that to form long-term, non-fibrotic, seamless interface with different components of the human body. At the same time, we integrate these machines into this soft material interface to form long-term interfacing between humans and machines. Now, in today's talk, I will give you two examples. One is on imaging, but on how to obtain huge amount of high quality ultrasound images. The other is on intervention. So bioadhesive ultrasound is the first topic. I will begin with this field of stretchable electronics. So who knows stretchable electronics or flexible electronics? Right, very good. Many people knows. So the key idea is people are making electronic devices to be thin, stretchable, and conform to the skin. Right? I give two examples from Professor Bao's lab, Professor Rogers' lab. Right? You can see. Then use this to measure EKG, EMG, EEG, heart rate, temperature, sweat, many physiological parameters of the body. However, one important modality is missing, which is imaging. Imaging of deep organs. But this community understand the importance of imaging. To see is to believe, right? My lab are trying to really achieve this goal, wearable continuous imaging of deep internal organs. And the modality we choose is ultrasound imaging. Ultrasound is one of the most widely used imaging modality in hospital. It's a non-radio, it's very safe to the patients. However, the patients need to go to hospital, and the sonographer will use a handheld ultrasound probe through this gooey gel to take snapshot images of different deep internal organs of the patients. During this whole process, the patient is in a static state, right? The patient cannot move around. The vision we propose is this. We call it a bioadhesive ultrasound. Imagine a few stickers, and I will explain details about these stickers. You adhere these stickers to different locations of the body, and then these stickers will provide wearable imaging. So this is, you can wire it at home or hospital, hand-free. You don't need to use a hand to hold it. Long-term, over days, continuous imaging of different organs, and during this process, the patient can be in dynamic state. You can run, you can do all kinds of sports, daily activity. So that's the vision we propose. So this is a very attractive. You can obtain large amount of time series data. There are other groups working towards this vision as well. So there's a field called stretchable ultrasound. For example, Professor Shi's lab at UCSD, Dag Dangren group at MIT, my colleague, Professor Feng's lab, they actually make this ultrasound imaging probe to be stretchable. So they can stretch it, conform it to different locations of the body to obtain this long-term time series image. The intrinsic challenge is ultrasound imaging require accurate transducer position. Right? Each of these small transducers, you need to know the exactly accurate location. The stretching, when you stretch this ultrasound probe, will introduce significant imaging error. And we just discussed, many students discussed, imaging quality and the amount of images are crucial for later analysis, diagnosis, right? My lab proposed a fundamentally different approach. So if you can remember something, you may remember this video. The approach, we call it a bioadhesive ultrasound. The idea is we develop this thin, rigid, high-quality ultrasound probe. So these are clinical quality ultrasound probe. But because it's rigid, we can leverage existing CMOS technology, dye and field technology to make this ultrasound probe. Then now this is rigid. How do you conform this to a soft, curved skin of the human body? Right? We further develop this soft bioadhesive couplant. This bioadhesive couplant is a hydrogel elastomer hybrid. So outside layer is an elastomer, which is dry, but inside is a solid, tough hydrogel. Right? So then this whole couplant maintain a solid state, and you have bioadhesive layers at the top and the bottom surface of this couplant to adhere the thin, rigid, high-quality ultrasound probe to the skin, different locations of the body. So this is really a clinical quality ultrasound probe adhered to different locations of the body. Now, just to show you the acoustic quality of this bioadhesive couplant, you can see here we compare the acoustic attenuation of our Bose couplant with commercially available couplant. You can see the attenuation coefficient of this Bose couplant across different frequencies of clinical ultrasound, this range is lowest. The reason is the bioadhesive ultrasound can literally adhere to the skin, without causing bubbles, without causing defects, give you a high quality, low attenuation interfacing between the human body and the ultrasound probe. With that, now we can see this is the process. You apply this ultrasound sticker to certain location of the body. Here is to the neck. Then the student turn on this tablet. This is the imaging tablet. And this sticker is connected to this wireless unit. The wireless unit will obtain this continuous imaging of different organs of the body over the time scale of 48 to 72 hours. Right, you can see the student now bicycling faster and faster. This is the chaotic artery. You can see the dilation of this chaotic artery. So large amount of time series imaging data, hand-free, and this is a dynamic patient. The patient can do daily activity during this whole process. What can be some clinical relevance? So number one is real-time monitoring of the lung over multiple days. We are getting prepared for the next COVID pandemic. So for any patient test COVID positive, now we only need to adhere a Bose sticker on the chest of this patient. Then we can send the patient home. We will observe, we will image the lung of this patient over multiple hours. Right? For the majority of the patient, you'll see image like this. Thin, smooth prolines. So this is a benchmark image. That means even though the patient is COVID positive, there is no lung infection. For very few patients, if you see irregular prolines, condensed A lines, that indicates potential lung infection. And for these patients, now I see many AI development in this community. AI will give the patient a warning. The patient should go to a hospital for early diagnosis, early intervention. So that's the potential impact of this technology. Another one is long-term real-time imaging of a cardiac dynamic. We know cardiovascular disease is a #1 cause of global death. Apple Watch made a breakthrough in this field. Apple Watch integrate EKG function into Apple Watch. However, EKG can only diagnose around 22% of heart attacks, right? Because it only gives you linear data. For the majority of this cardiovascular disease, you need imaging modality. But current imaging modality is a snapshot. You go to a hospital, the doctors take a few snapshot images. Now with this Bose sticker, we obtain over 48-hour long-term continuous imaging. And this view can be 4-chamber view, can be 2-chamber view, can be different viewing angle of the patients over 48 hours. Once the patient feel chest uncomfortable, the imager will take time series image, send this to clinicians right away for real-time diagnosis and early intervention of cardiac disease. Another possibility is long-term continuous monitoring of a blood pressure waveform. over 1 billion adults, 22% of a global population have hypertension. Hypertension is the most important preventable risk factor for premature death. Right? It's highly desirable to have long-term continuous monitoring of your blood pressure waveform. However, who in the audience has a blood pressure cuff with you? Right? I see no one, because it's cumbersome, not the stable data. It turns out your blood pressure is correlated with the diameter of your carotid artery or some major arteries of the body. Now we have the capability to obtain long-term continuous imaging of this critical blood vessels. And by some simple segmentation technology, we can convert these meshes to your blood pressure waveform. So here is the potential impact. Now this is my systolic blood pressure over time. You can see this is my blood pressure spike after some sports training. Another one, giving this talk, I'm not in this community, I get nervous. You can see the blood pressure getting high. So my cell phone will send me a warning. Either I should calm down or I should take some medication. That's the potential impact. And this technology is maturing. So there are startup companies now achieving this goal. Another one is long-term continuous imaging of your muscles, right? So ask you a question. Do you know how much exercise is sufficient? How much is too much, overdone? You probably don't know. However, your ultrasound image will know. So this is, at a static state. After, training, you can observe the microstructure change of the, muscles, and even during the recovery stage, right, you can see the evolution of both blood flow and the microstructures of the blood vessels. So it will tell you how much exercise is optimal for you, personalized training program. Right? Sports medicine, rehabilitation, many potential impact in this field. Now, in addition to imaging, we can also measure the rigidity of different organs. That's called ultrasound elastography. Right? So we developed this BOS-E, Bioadhesive Ultrasound elastography. The elastography can generate this RF, shear wave pulse, to induce the pulse, to generate the shear wave, and image the tissue organ motion to calculate the rigidity, the modulus of the corresponding tissues. For example, continuous monitoring of acute liver failure after liver transplant. This is very important for critical patients. You can see here is the data on animal models. This is shear wave, elastography's measurement. This is the control measurement, match with each other very well. And during liver failure process, indeed, we observe around 2.5-fold increase of the rigidity of the liver of this animal model. That's the potential impact. So what's our vision? Now we are working towards personalized foundation model of the body. That's by integrating wearable imaging data plus AI. I didn't discuss, the models. So you guys present more sophisticated models than we developed. We believe the huge amount of high quality time series data is crucial in this game. So our goal is for individual patients, we will obtain personalized data over days for diverse organs. Then we can even study this correlation among these organs at a healthy state or during diseased state. Potential impact, long-term continuous health monitoring, early diagnosis and intervention of diseases, measurement of a tumor development, use a shear wave elastography. You can measure the rigidity change of tumors, brain development, fetal development, preterm birth, women's health, and this list goes very long. That's our vision of this field. really now wearable device can go beyond linear data. It can provide you images. And by integrating these images over long term, we will have another level, potentially another level of understanding of human health and the physiology state. Now, the impact actually is not limited to health. How about beyond health? What if for healthy subject, what can we obtain? By obtaining this long-term time series imaging data, we actually can understand the motion of a human body. And nowadays, in the field of humanoid robots, what is the most important commodity? Data, right? What's the human motion when human performing different tasks? And we believe with this kind of wearable ultrasound imaging, you can obtain data without cameras. And that data can be used to train robotics. And I will give you one example. So the example is on hand, right? Hand is the most dexterous manipulating organ of the human body, right? So when you discussing humanoid robots, hand is usually the focus. Elon Musk just recently made this comments. This Tesla robots, they are trying to achieve very dexterous hand. Hand data when performing different tasks is a number one important commodity during the training of robotic hands. How to obtain such a huge amount of data? One way is using EMG. This is electrical signal from the muscles. Meta recently developed a wristband. By measuring EMG, it can predict the hand gestures, right? A few different gestures, whether I'm open my hand, whether I'm doing pinching, whether I'm moving my thumb, that's it. Now let me propose and actually report one major advance in predicting hand motion. So here's the thing. If you can obtain long-term continuous imaging data of the wrist, right? And this imaging data does not need to be MRI. Ultrasound imaging data is sufficient. Then you can continuously track all degree of freedoms of the hand. Every joint of the hand, their motion, degree of freedom, is reflected by the ultrasound image of your wrist. So in the paper, we even report the corresponding regions for different degree of freedom. So there are 22 degree of freedom, all reflected by the change of different imaging regions of your wrist. So certain change represent an angle variation of the joints. So that's that. And then now how to analyze this, right? So I give you a number of images. How do you predict the degree of freedom of different joints? AI, machine learning. We first, trained a model with labeled imaging data, right? So every imaging data, there are 22 labels. These 22 labels are the 22 degree of freedom. You train the machine learning model, and they use that to predict the hand motions, continuous hand motions. Let me show you the results. So here is one. This is a real-time, fully integrated this wristband. So you can see the student is using this different pinching motion to control the size of this MIT logo. Pay attention to this. Here, we are not predicting one gesture. This is really the different degree of freedom of this motion, right? So we can, pinch, hold. Traditional EMG cannot hold. We can, bend the wrist to different degrees, and this logo, rotate accordingly. This can be achieved in real time with such a small integrated device. based on analyzing this data. So this is much more sophisticated than what a Meta wristband can do. Then I can claim that all EMG-based hand tracking device can do. And we are using some quite simple but robust imaging and analyze programs. If this community can develop more sophisticated programs, we are delighted to collaborate. So this is another one. So now the hand is, this image is telling you the degree of freedom, and then this degree of freedom is controlling this robotic hand. You can see, I bend the thumb to different degrees. Traditional EMG cannot do this. And then once the degree is sufficiently high, I shoot the ball into the basket. To conclude this part, let me play a music. So in real time, this is the hand. This is the image of the wrist, converting to 22 degrees of freedom. Now we are controlling this robotic hand. By the way, this robotic hand is a simple one. It doesn't have 22 degrees of freedom. But this ultrasound image can predict all 22 degrees of freedoms continuously. Let me use one fundamental challenge in science and technology to conclude this part of my talk. Currently, we achieved a super resolution imaging of single cells, right? Actually, 2014 Nobel Prize in Chemistry is on this topic. Very high resolution imaging of single cells. However, human body contains trillions of cells. And these cells self-organize into organs, organ systems, tissues, right? And they interact with each other over your lifetime. Can we achieve long-term continuous imaging of the full body over days to months? The resolution may be lower, but now you have the full picture, right? Understand the different organs' interaction in your health state or in diseased state. Can we achieve that? Currently, we do not have such a imaging modality to achieve such a capability. Now with a bioadhesive ultrasound, we believe we are getting close to achieving this goal. So different organs, we just use different stickers to the corresponding location. Then you can send this patient or even healthy subject home and obtain this long-term continuous imaging data over time, over weeks, even months. That's our goal. Eventually, what these data can tell, we do not know. But we believe, I think some students discussed this, more data can give you emergent phenomenon, emergent understanding. And we are really achieving this goal to see whether we can achieve certain understanding of human physiology on a system level, or help diagnosis or even prognosis of disease on this system level by leveraging bioadhesive ultrasound. Very good. Let me switch gear. Now go to the second topic. It's about intervention, especially telerobotic neurointervention. We know stroke is globally #1 cause of long-term disability, #2 cause of death, 15 million cases per year. Basically, 1 in 4 adults in our lifetime will have the chance to develop a stroke. Now, let me ask another question to the audience. Who or your family member has been affected by stroke? I actually have, right? So you can see this is really more than 1 in 4. Really, this is a huge global impact. Stroke can be reversible if you treat stroke within this golden hour, right? But if you miss this golden hour, time lost equal to brain lost. So that's the impact of a stroke. How to treat a stroke? This is called thrombectomy, standard care. The clinician will make an incision on the femoral artery on the leg of the patient, and then insert a long guide wire all the way from the leg to the brain to clear stroke. Then for navigation, you can see the tip of this guide wire is J-shaped. The neurointerventionists will rotate this guide wire outside the body. This J-tip will rotate inside the body to go to the right branches of blood vessels. There are a number of intrinsic challenges. Long training time for neurosurgeons, 4 to 7 years. Unavailability of neurosurgeons, especially in rural area. Right? For example, in Seoul, I think CAST medical school should have this kind of neurosurgeons. But in rural area, even in Korea, you need to transport the patients to these major hospitals for such treatment. And the majority of the patients lose this golden hour during that transportation. Then for these heroic doctors, right, they suffer from accumulated radiation from X-ray because you need to image the patient, image the guide wire and the blood vessel during this process of a neurointervention. So these heroic doctors suffer from accumulated radiation of X-ray. On the other hand, time lost equal to brain lost. How can we resolve this challenge? My student, a brilliant Korean student, Kim, proposed this vision. His dream is to achieve highly operated, even autonomous robot to navigate within the blood vessels of the human brain to clear stroke, so that for any patients, right, they can be treated within local clinics instead of transporting them to major hospitals. The robot he developed is this magnetic robot. So you can see this is a guide wire, but now it's a straight, not the J shape anymore. And within the guide wire, we disperse these hard magnetic particles. These are like small magnets. When you apply an external magnetic field, you can see the guide wire can bend towards the direction you apply the magnetic field. Right? So lots of fundamental studies in developing this material. You can see we even develop a very interesting, sophisticated robots based on this, this new materials. Eventually, develop this guide wire robot, and then he also integrate this guide wire robot into the standard care system. So this is a C-arm fluoroscopy to give you the medical imaging to guide the navigation of the guide wire. Here we use a robotic arm to hold a magnet. This is a permanent magnet to apply the external magnetic field. Then we use this joystick control system to control the position of this magnet to apply the magnetic field. And then there is another system. This is advancing retrieval unit to move the guide wire forward, backward. The navigation and the advancing are decoupled from each other. So this magnetic system is focused on navigation. This is on advancing or retrieval. Based on that, we carried out a few standard care intervention within this realistic phantom model under X-ray fluoroscopy. Right? The first one is the treatment of this aneurysm. So if you do not treat the aneurysm, it can burst, causing a hemorrhagic stroke. So here is the process remotely, right? The interventionists are remotely controlling this robotic system to coil this target aneurysm up. So in the first step, we navigate this guide wire robot to the target location. In the second step, we deploy the microcatheter. So you can see this small conduit. It's a piping system. In the third step, we withdraw this guide wire robot. And in the last step, we will deploy the platinum coil to coil the aneurysm up. So you can see, in this process, we actually don't need AI too much. So the clinician will read the medical image, but we do need a robotic control system. So the image will guide the robotic system to deliver the guidable robot to the target location. And here, this is a virtual environment. Collision avoidance already being hard programmed into the whole system. So this is the one. The second one is about this is ischemic stroke, a clot, right? Using similar process, you can deploy the robot to the clot and then use a stent retriever or aspiration catheter to retrieve this clot. Not only we performed the standard of care in phantom models, we also carried out in realistic live large animal model. This is a pig model. We use the bronchial artery in the flexed position to approximate certain major blood vessels in the human brain. So you hear there's a beeping sound. This is the hard beeping of this pig model. So during the whole process, the pig is alive. And now, so through this fluoroscopy imaging, we are navigating the guide wire to the target lesion of this animal model. The whole process is carried out remotely. You can see this is a robotic arm, the system within the surgery room, CAD lab, and the interventionist is performing this task in another room, even in another city. And many people are asking about the collision. Again, the collision avoidance has been hard programmed into the system. So there is impossible to occur such a collision. I will just show one data to compare the performance of a manual operation and this robotic controller. You can see for neurointerventionists, it takes over 4 years for manual operation. For our robotic system, only on the order of hours. They are very familiar with playing video games. And for the joystick controller, very intuitive to them. So very easy to control. And you don't need to use hand to twist the guide wire anymore. So very easy to learn. And this is even more important. The number of undesired steering maneuvers, right? For example, touching the blood vessel, or even pushing the aneurysm of the patients. So this is highly undesirable. For manual operation, because the guide wire tip is a J shape, unavoidably, no matter how many trials you try, there's always some undesired steering maneuver. But for the robotic system, very quickly, you reduce that to 0 because the robotic guide wire is straight. And when you apply external magnetic field, they bend on demand so that it doesn't touch the aneurysm, doesn't touch the blood vessel walls. And this is our clinical collaborator, Dr. Aman Patel. He commented, with his help, they didn't need my thousands of hours of surgical expertise to approach my level of skill. And our vision is really deploy this kind of robotic system at as many clinics as possible, so that clinicians like Aman Patel or his trainees can carry out this kind of stroke treatment timely and remotely. What's the next step in terms of technology development? So you can see this navigation process from the bronchial artery to the stroke lesion is highly repetitive, but it's quite a cognitive burden for the neurosurgeons. This process, we believe AI and the quantitative model can really automate this process. This is much easier than the autonomous drive of your Tesla. Because we already have the high quality imaging from fluoroscopy, from angiography. Then the task is, Here is the position of my guide wire, current position of my guide wire. Here is the desired trajectory of my guide wire. What magnetic field I should apply to bend my guide wire towards this desired trajectory. So that's the problem. This is simply solved by deep learning, by neural network. After learning all these behaviors or learning the simulation results of this model, how to bend the guide wire to the desired location. So I want to show some preliminary results. You can see here, these green dots indicates the tip of this guide wire. Once the tip of the guide wire robot reach a critical location, then now this robotic arm under the control of AI and quantitative model will move the magnet to optimize the position, location, to bend this guide wire to the desired trajectory. And then the advancing unit will push the guide wire further to the next steering location. This whole process can be automated with a very high successful rate. Because this process is supervised by clinicians, if anything goes wrong, the clinician can intervene in the process and take over the control by joystick controller to navigate this guide wire robot. So it's also very safe. And also, the clinician is in the loop. Clinician is indispensable in this process. But the collaboration of a clinician, AI, and the quantitative model will dramatically improve the clinical outcome. Okay, let me summarize this part by proposing another fundamental challenge in science and technology. We already achieved genetic editing of cells on a molecular level. CRISPR is one of such an example, right? So you can really modify cells, the gene of cells on a molecular level. However, can we use a robot to minimally invasively edit the full human body on a cellular level, right? To minimally invasively remove a tumor from any location, including the brain of the body, to deliver drugs, cells, even CRISPR to any desired location of the body, minimally invasively. Can we achieve that? Now, this kind of guide wire robot, right, regardless the form, we are using magnetic, many other groups are developing different forms of this, can be miniaturized to the scale of a 10 micrometer. Right? Then we can really leverage this small size of the guide wire robot to navigate most of the locations of the body. And then once you reach the lesion area, you can do lots of follow-up intervention, delivery, or removal of tumors. So we believe this, especially endovascular or intravascular robots can represent a promising direction to minimally invasively edit full human body on a cellular level. Very good. Let me summarize. I think I introduced the vision of merging humans and machines that can be wearable devices or can be intravascular robot. You can see now really human and machines can get closer and closer. The impact, better health, that's something we all want. Better understanding of biology through new sensors, imaging capability, even robots, and the future of humans and society. So here are two examples. Two startup companies now, Xuanhe and Magnando, are truly advancing this towards FDA-approved products in the near future, hopefully. Let me thank my collaborators, Professor Qifa Zhou, Xiaochuan Liu, Anantha Chandri, and Matt Gunis, and also clinical collaborators over 10 years, Christoph Nabzi, Aman Patel, Iris Webbs, Leah Griffiths, Tiffany Griffiths. Many of the clinical collaborators, trust our technology so much, eventually they become co-founders, advisors of our startup companies. And of course, the funding organizations who support our research. Thank you very much.
So many interesting ideas there. So I have a question for you.
Sure.
About the bioadhesive ultrasound. How inexpensive do you think you can make that device, and do you envision it be marketable to the general public?
Very good question. So the question is about the price of the bioadhesive ultrasound. Actually, I can answer you because Sonology now is selling this. Well, let me give you a bulk number. Currently, the bioadhesive ultrasound, each unit is similar to Butterfly IQ Plus. And we believe under mass production, we can further drive the price down multiple times. And, but in comparison with Butterfly, we can obtain long-term continuous time series imaging of deep internal organs. So that's something, unmet clinical need that we can achieve.
And do you think that could be marketable to the general public?
It is. You can contact Sonology to buy these devices. It's not FDA approved yet. So, but if you get IRB approval, you can try it on your, volunteers.
Yeah, thank you for the great presentation, and particularly on the bioadhesive ultrasound for wearables. I think your answer for the first gentleman kind of answered some of my question. Looks like you are using some Butterfly CMOS-based CMOS sensors for your wearables.
Oh, let me clarify.
Yeah.
We did not use Butterfly technology.
Okay.
So, I mean, the price is similar to Butterfly units, but we did not use CMOS technology.
Okay, great.
Our device is based on piezo ceramic technology.
Okay, great.
So the imaging quality, I would say maybe higher in some sense.
Yeah, my question is, because the traditional ultrasound for different use cases use a different probes. They are pretty sophisticated, and with your compact form factor for wearables, I assume it's limited on the performance. I just want to understand where there are limitations on performance as compared to the traditional ultrasound imaging system, and what clinical condition can you achieve use monitoring wearables as compared to the standard ultrasound care?
Yeah. So, very good question. The question is about, number one, what's the imaging performance of our BIOS system compared with the existing clinical ultrasound? So here we did a systematic comparison. In comparison with existing point of care ultrasound, those are portable ones, they are on similar level with Butterfly and many others. So they are on similar level. We know because due to the small form factor, lower power, this imaging quality is inferior to those card-based large ultrasound imaging modality. However, we can deliver long-term continuous imaging. And for the clinical application, I can give you concrete examples. Currently, we have a large-scale clinical trial at Brigham Women's Hospital, Harvard Medical School, on cardiac patients in ICU. So in such a very constrained environment, we can deploy the BIOS equipment without a problem. Then for home use, we believe it's also possible. There are some issues to address. That's our next step. So we believe in terms of the application scenario, we can really greatly expand the impact of ultrasound. Currently, it's very limited in clinics, right? You need a sonographer to manipulate the ultrasound probe. We believe we can change, even with existing technology, to really change this into something broadly impactful.
Okay, wonderful. I'll follow up offline. Thank you.
Thanks so much for your talk. Dr. Zhao, do you hear me okay?
Yeah, sure.
Yes, so my question is similar to his. So if you allow for me to play devil's advocate, when I saw those clinical applications of an ultrasound, like a portable, attachable ultrasound, if I feel like that, if I have to have the ultrasound on my chest, it seems like I need to be hospitalized first. I mean, the question is that how come the people in the public need the continuous monitoring of the heart? So that it's more like whether it's going to create some kind of a clinical impact in the community. That is first question. So for example, you mentioned about the muscle, how much exercise is going to be necessary. Well, I can feel fatigue when I work out, so I know when I need to stop. And then blood pressure measurement can be done by just simple Apple Watch. So I'm not sure whether your invention, which is brilliant, I love it, but I do not know whether we need to stick in on our skins, creating some skin irritation whenever I shower. It actually bothers me. But instead, we can have like a portable ultrasound device. If we have like a ultrasound gels with $1, we may be able to try it, and as long as the doctors has time to monitor it, perhaps that is going to be a more reasonable alternative plan.
So, very good question. The question is about the daily use, especially the home use of this bioadhesive ultrasound. For example, is there a true need of a cardiac monitoring at home? Is there a true need of a continuous blood pressure monitoring at home? And are there skin irritation challenges? Yeah. These are all great questions. So let me first let you know the need. So I wouldn't say this is for everyone, but we do have currently clinical trials ongoing, especially for discharged patients. This can be a game changer for them. They wear this at home for critical cardiac monitoring or critical bladder monitoring to really inform them whether they should go back to hospital for certain checkup. So there is a need. Now for the continuous blood pressure monitoring, I don't believe Apple Watch can measure your blood pressure. The new Apple Watch can tell you the possibility of hypertension, but that's not a really blood pressure measurement. There is a strong need for general population. I'm even need that to continuously use a sticker to monitor your blood pressure variation. But more generally, this is a new technology, similar to many others, right? People do not accept Apple Watch or do not accept EKG. I'm not saying this eventually will become an indispensable device for health monitoring, but from feedback of many clinicians, we do see a need, a strong need within the hospital and outside the hospital. And we believe by building this personalized database, maybe we can further expand the need. So this is really a research project. The clinical application are inspiring more clinical need for us. But we are moving this field forward. And hopefully more students, colleagues in the field of ultrasound may get interested in continuous ultrasound monitoring, imaging, and analyzing those ultrasound images. Yeah, go ahead.
I'm from media, I'm from industry. So actually following your discussion, because when we talk about ultrasound, we usually think about it as a medical device for specific diagnosis. But from what you're talking, the ultrasound that you're talking about is on the boundary of a medical device and a consumer device. But walk that road down. If we walk the road of a medical device, it will go through certain diagnosis, medical device, FDA approval, then come to the market. But if we walk down the other road of a consumer device, it will become how fun it would be, what it can bring the benefits to everybody. So basically that's two paths. And if considering this adhesive ultrasound as something totally different from the previous ultrasound that in our impression, then how would you think it could produce more data to generate more insights into the data that we collect, and also more AI applications or other applications based on the top of this invention?
Good question. The question is so actually a great point that a consumer device, home use, and clinical device are different approaches. Currently, we are pursuing the medical device approach. So the major focus of the medical device is within hospital, long-term continuous monitoring of critical organs and physiological condition, and there is a strong clinical need for that. Now, for home use, I would say we are keeping that as a research project. But no, let me take one step back. I believe the VR and the hand tracking can be realistic. That's different from clinical need. Can be a potential market, because Meta already commercialized the EMG band. And from our current results, it's just much superior to those EMG monitors. So that can be a potential consumer application.
Thank you.
Thank you for the inspiring talk. So I have two questions. Question number one, typically ultrasound imaging have a lot of artifacts. So then my question is, how do you handle the artifacts, especially you have the adhesive over long-term monitoring? And question number two is there any possibility to, for example, to deliver the bioadhesive ultrasound in an endoscopic way and getting into the human body to assist the endoscopic surgery? Because typically a lot of internal organ surgery really need such kind of imaging to look at what's happening underneath the tissue. So that's two questions. Thank you.
Yeah, two great questions. The number one question is about the artifact of the bioadhesive ultrasound. The artifact, I believe we eliminate or dramatically reduce the motion artifact by really strongly coupling the ultrasound probe to the body, and the ultrasound probe is non-deformable either. However, similar to all other ultrasound modality, there are artifacts, this side lobes, many other things. Now, the solution will be following traditional ways to address those artifacts. And, because here, the BOSS function is a long-term continuous monitoring. We are actually trying to capture abnormal effect, abnormal phenomena. And, with AI, with, machine learning algorithms, it's actually relatively easy to pick up those phenomena and then let clinicians to further analyze those phenomena. So that's number one. Number two is about the endoscopic, ultrasound, whether we can use bioadhesive ultrasound for endoscopic application. I wouldn't say you want to adhere the, the ultrasound probe to a certain location of the blood vessel. However, this kind of coupling technology can be applied there so that you can obtain potentially superior, intravascular or, endoscopic ultrasound imaging.
Right. Thank you very much.
Yeah.
Yeah.
As a robotics guy, I found actually both parts of your talk to be fascinating. And like others, my immediate questions concern the ultrasound device. First, what is the field of view of that device? And then it seems to me that for a lot of these applications, you still need some kind of a skilled way to get the thing adhered so you have the right field of view.
Yeah.
So it looked like a fairly small probe, and how broad is the field of view, and how sensitive is that to your application? And then, there's also possibilities of some assistance in getting that placement.
Yeah. Great question. The question is about the field of view of the bioadhesive ultrasound. The probe is on the order of 3-4 centimeter.
Oh,
so
it's a
similar to
larger probe,
traditional
yeah.
ultrasound probe. And because again, we don't need to make it a stretchable, fancy, bendable. This is something rigid, and then we use the coupling to adhere that to the body, firmly couple that to the body. So it can be similar to conventional, clinical ultra. However, you cannot move it around.
Right.
Yeah, very good. To compensate that, we can adhere multiple probes on the body.
Oh, yeah,
So-
which, what I was then going to ask is if you're placing multiple probes, their relative position changes. You can begin to look at ways of dealing with that as well.
No, those probes work independently.
I know they do, but as a future research area, it seems like there are ways to exploit the fact that you've got these independent probes moving with some variation relative to each other.
That's a great. Then you are talking about mocks of this probe, coordinate them.
Yeah.
So that's definitely possible. We are actually exploring that. Then the relative motion. Now you need to consider that as a factor.
Yeah.
But currently, for example, for the clinical test within MGH, Brigham and Women's Hospital, it's a single or multiple ultrasound probe working independently. You have a few field of view continuously observe one or multiple organs.
Okay. Well,
Thank you.
It sounds to me like there is a collaboration project brewing up here. So I think we have to close this session and announce the next session. Please feel free to approach the speaker and we'll have a great discussion. Thank you, everybody.
Thank you.
Let's thank the speaker again.